Okay, and with that, we've got about 12 minutes before we move into our small group session. So we're happy to take some questions from the audience. Go ahead. I think it's her.
Hello? Yeah, thanks. Sorry. Ms. Benedetto, why would you use AI as opposed to stochastic methods for your work?
So you and I had a very nice conversation before I came up on the panel about your background in this space on a deep technical level. So, I think that's part of what's going on with technology. So much is changing so fast. We all make judgment calls on what we're doing, but I'd be happy to speak with you on the technical level and with our CTO. If you have another method that makes more sense for us to use, let's definitely talk about it. Excellent. Let's talk.
Other questions? We have some. We go have them all across the room. So go ahead, Emery. You can go to the next one.
Hi, thank you all so much for being here. My name is Abigail Keith. I'm a junior analyst on the Eagle Venture Seed Fund at American University. So I like to think we're the next stage of investors in the tech for social good. My question to you, kind of an open floor question, is you all face different constituents on a daily basis with different needs. So I'm wondering if there's a specific area of need you see in those people that maybe you're not quite sure how, but you think AI could be placed in those areas to improve innovation and improve their wellness in their daily lives.
AJ, do you want to take that one?
Yeah, I can give a specific example. So I mentioned we license technology to HUD certified housing counseling agencies. And so the life of a HUD certified housing counselor is certainly to talk with folks who are trying to become homeowners, but it's also a ton of paperwork. You have to record everything that happens in the appointments and make sure that that information gets reported to various funders. And we did some research with one of our pilot partners, and I think they were spending, the counselors that is, were spending less than half of their time during the Monday to Friday work week on actually delivering counseling services. The rest of the time was spent on administrative tasks. And so I think, to make it really concrete, right, you're a housing counselor. One of the things that you have to do during your appointments is take notes, transcribe everything that happens, and then make sure that that gets put into the right format to be sent to your client in the form of an action plan, to HUD in the form of outcomes, and all of the demographic data needs to be recorded, right? And so right now at hundreds of agencies, this is happening literally with pen and paper. The next step up might be sort of technology systems built 20 years ago that don't talk to each other. And so it gets recorded in one place and then typed into another place. And it's just a ridiculous, colossal waste of time that could be entirely solved by a mix of old school technology, new school technology, AI transcribing tools. And so, we hope to gently nudge this industry into the, I would settle for the 21st century, I guess. That's the one we're currently in. Even though it seems like we're operating in the future a lot of days. So, yeah.
Great. Okay. Go ahead. Any has a question? Oh, we have a mic. We have a mic for you, I think. Yeah. Great.
I had a law school professor at USF who, when we as young law students would get up in arms about the unfairness of things, would say, we live in a corporate capitalistic society. And that was our reality check. And so bringing that reality check to this discussion, and Dr. Evans pointed out, a lot of the times the AI for good is maybe serving communities that don't have a stake. And then when priorities shift, they get harmed. So what have you seen now as positive incentive structures for corporations to do good things with technology? And what can we do better as a country, given we are capitalistic and that's not changing yet? And nor am I arguing that it should necessarily. But how do we incentivize companies and then hold them accountable?
I think Stephanie and Ben might be the best to answer that one. Go ahead, Stephanie.
Yeah, no, that's a great question. We and this kind of touches on what you were asking earlier about which technology you're using and why. When we make these kinds of decisions of what we're using and who we're serving and what the purpose is, we spend a lot of time looking at what is public, what is private, and where are the security, the controls, and the guardrails around that. Because a lot of the stuff we're handling with big companies, private data, we don't want that in certain public models, and they don't want it that way either. And you just described an example where an AI went off the rails. Like, how do you put the guardrails in and control it? And so when we're working with companies, we think it's our job to obviously do the best we can to put those kinds of rails in. But obviously, as you wake up and there's a new version of Claude or whatever every day, it can feel hard to keep up with. But I think the more we learn and the more we see of what needs to be private, secure, and controlled. We use Llama right now, but we're not bound to it. We just use it for some of those concerns, right? And so the more we're learning, I'm encouraging our CTO and co-founder to educate and share that information with others, the learnings, so that in the future regulators and others understand the implications and we can balance that public, private, secure, controlled environment. Because there are unknowns.
Great. Ben?
Well, the momentum of the last few decades has been about concentration as opposed to market expansion, right? And so when you expand markets, people have consumption power, right? And then they're less poor because they have stuff and they can do stuff and generate value by their personage. Corporations are not in the business of giving money away, right? They're not charities. So I think the incentives come from government usually, tax incentives, tax credits, things like that. But the government now is also in a concentration trajectory, which obviously is not painting a good picture. We talked about that future. I think that the solution will come from startups, people like you all, who are creating new ideas and new models using technology to activate market expansion outside of the large macro forces, the corporations, the US government. And then as these markets expand, then the corporations will subsume them and join them. And hopefully that'll increase overall prosperity. But I think it's going to come from the new people.
Okay. Other questions? Hi.
I think that's a perfect tee up for my question. I'm a startup founder, physician of a health AI company called Evra Health. We're trying to make healthcare accessible and affordable for all through responsible AI and really tackle the chronic disease epidemic that continues to plague our country. This question is more for Jacob and for Ben. So curious to know how blockchain plays a role in terms of how healthcare can be delivered in a more secure, private way. And then for Ben, as a council member, like in your city of Berkeley, how do you see AI playing a role specifically for healthcare, for improving access to the social determinants of health? In the last few months, we've seen every single big AI company, most recently Perplexity, is really entering the space of health AI. So the stakes are pretty high for big tech and also smaller startups.
Sure. Yeah, I can start with that. I mean, I think the holy grail that people see with health and blockchain has to do with being able to actually prove that you have like verifiable health records and making those health records portable. I mean, it's been a long time since we've had like electronic health records, right? But then people still have a lot of trouble getting that data to be portable and go with them to whichever physician they might be, whichever network of hospitals they might want to go to. There's a lot of work that goes into that. Like so at Filecoin Foundation, we're a cloud storage network, and there needs to be there's a certain bar that needs to be met for public data, for private data, and on top of that, there's like HIPAA compliant health data, right? And so I think as we see a lot of this technology progress, we're going to see more of those controls and those access controls kind of come up within the tech stack within these different blockchain ecosystems. And I'm hopeful at least that we'll see more and more of that health portability, the health data portability come to life. I know there's an organization that is like starting to use our tech to do that in South Korea right now. But I think every jurisdiction has its own rules and regulations that need to be complied with. So I think it's probably going to be a little bit of a bumpy ride.
Yes, and so you're spot on. The industry is ripe for disruption. There's so many layers and filters between the person and the care delivery system. So making that smarter and faster. But to your question, the social determinants of health, this is upstream care, right? Wellness care, not sick care. Two things that we saw that we utilized in Berkeley on the building I mentioned, the Step Up Housing, this landmark building, got nominated for an award, a global award recently. We're going to win, I think. I'll be back here when it wins.
Yeah.
Bloomberg, talking to you. And so these are homeless people. They got in the building, and in addition to the constitution of the building, which says each person has to contribute to the well-being of the neighbors in the building any way you can, there's also real-time sort of like radar analysis of the person. So real-time 24/7 EKG. So you can see their heart rate, everything, all the issues that would confound you. You find out 6 months later this person's going to die. You can catch it at the same moment. With one person monitoring that, with AI, and AI allows you to really deploy such advanced machine learning to read the little permutations that come from a system, a radar system. You can do so much. And the other one is for community healthcare workers. Community healthcare workers, I believe, by the way, is the job of the future because they're human jobs the robots can't do, and anyone can do them. A local person from the community can get 6 hours of training and go check on you. And we found that just knocking on your door and visiting with you for 20 minutes is more effective than a doctor or hospital stay. You take your medicine, Bob? How you feeling, Bob? You know? And that person can be armed with interactive communication to guide them in the conversation with the person. And based on the feedback from the conversation, deploy real-time interventions, right? So things like that.
That's great. We have so many other questions. We should have done 90 minutes for this panel, I see. However, you are going to get a chance to ask questions and to discuss things with our panelists and with all of us at our next small group session. So let me just do a little quick housekeeping. If you haven't met the USF law students who are here, they are in the back with the microphones, and please do take the time to meet them. Also, if you have legal questions that came up out of the panel, we have lawyers from K&L Gates here who I'm sure would be happy to chat with you about that. If you have blockchain related or decentralized tech questions, Filecoin Foundation rep is here. And of course, I'm happy to answer any questions folks have as we move forward.